Hi family, and welcome to the channel. My sweet cute name is Auntie Rose, and today we want to do a healthy video. We want to go healthy. We want to speak about diabetes, and today we are having Dr. Elizabeth in our channel. She wants to educate us on diabetes. So help me welcome Dr. Elizabeth Mwangi. Yay! Welcome, Daktari.
Thank you very much, Daktari, for having me here. I'm honored, and just like you've explained, today we shall be talking about diabetes, and specifically type 1 diabetes.
With all mine, kindly introduce to us what is diabetes and what is diabetes type 1.
So diabetes is a chronic condition that is normally characterized by high sugars in the bloodstream, and this normally happens when there is either no insulin production by the pancreas or little insulin production, or when the body is not able to make use of the insulin that has been produced by the pancreas.
So it's the pancreas that produces the insulin?
Yeah, the pancreas produces the insulin, and actually insulin is a hormone that normally helps the sugars in the bloodstream to get into the cells. Remember that the body needs energy for it to function normally, and the main source of this energy is glucose.
It's glucose.
Yeah.
Okay. What are the signs and symptoms? Probably tell us, please.
Yeah. So with type 1 diabetes, majorly, actually I forgot to mention that we have several types of diabetes. There is type 1, which is what we'll be looking at in today's topic. We have type 2, and we also have gestational diabetes.
Yeah.
So with type 1, we normally find that the insulin fails to produce insulin, or the insulin that is produced is very little. We normally have a test that we normally refer to as a random blood sugar test. And with random, we mean that you can have a sugar test at any time of the day, regardless of the fact that you've eaten. So with random blood sugar test, anything that is above 11.0 millimoles per liter will be considered to be high.
Okay.
And then you also have a fasting blood sugar test, which is normally done when one has not consumed any meal or any food. So with random fasting blood sugar test, anything that is above 7.0 millimoles per liter would be considered to be high.
Meaning when I go to hospital right now and my sugars are checked and it's at 10, that is not considered as diabetes.
Yeah, that would not be considered as diabetic, but remember, it also depends on what you've consumed. If you've consumed something that is very high in sugars, for example, a Fanta soda, or sweets, or sugar, that can also raise your sugar levels.
Okay.
So if the levels are not so high, it's always advisable or your healthcare provider may advise you to keep checking the sugar levels, or you'll be visiting the facility or the hospital frequently, and they'll keep the records, and with that they'll be able to advise you accordingly.
Okay. Tell us about the investigations other investigations that we're supposed to do rather than the random blood sugars, if there's any.
There's also a test that you normally refer to as HbA1c. But this test is not really a diagnostic test. Majorly, the random blood sugar test and the fasting blood sugar test are majorly the diagnostic tests. But with HbA1c, this test is normally used to check how the sugar levels have been in the past 2 or 3 months.
Okay.
Yeah.
Thank you. Management. Tell us on the management and preventive measures. Management involves pharmacology and non-pharmacology. Start with the non-pharmacology ones, non-medicinal ones, as you go to the medicinal ones, if that is the easiest term I can use.
Yeah, so with the non-pharmacological management, basically we look at the diet, and with the diet we try to encourage one to reduce a lot of starch intake. And if you are taking starch, for example, chapati, kama ni chapati, it's advisable to have brown chapati or to use the brown wheat flour. The same with bread, and the portions actually also matter a lot. So kama uko na sahani with your plate, it's advisable to ensure that half of the plate has greens or vegetables, and then the other half you'll divide you'll divide again
the other half.
Yes,
okay,
you'll divide it into two. So part of it will be proteins, and then the other part will be starch.
So a quarter is starch, then a quarter is proteins, and then a half of it it's
greens or vegetables. Yes, and don't forget to incorporate a lot of fruits. Yes, a lot of water. Yeah, all these will help in regulating the sugars.
Okay.
Yes.
Let's go to the medicinal ones, if I may term.
So with the pharmacological management, majorly type 1, remember we said that what happens is that the pancreas is not able to produce insulin. So what happens is that majorly you use insulin to manage this. With the drugs may not work, or they don't normally work. So you use insulin to control the sugars. So the patient will be advised or will be guided on how to be injecting themselves. Most of the time you use mixtard. That is what we use especially in our Kenyan setup. So you'll be injecting mixtard in the morning and in the evening on various parts of the body as advised by your healthcare provider.
I'm assuming I'm below 35 years and my sugars are at 20, if I may say. That means I won't take any medication. I'm just going to use insulin.
Yes, if your sugars are at 20 and you've been diagnosed that you are diabetic, majorly we'll work with diet. Dietary advice is very important.
Okay.
And then insulin. Majorly you'll use insulin because the oral drugs will not work because it's insulin that is missing, and it's this insulin that you need to regulate the sugar levels in the bloodstream.
Okay, the last question, or maybe I have a few more. If you have any question, please comment down below as I continue asking questions that I think you need to know. Okay, yeah. So my question is, suppose I have been diagnosed that I have diabetes type 1 and I'm finding it so difficult for me to start the medication. I am in denial that I have diabetes. Can you tell me about the complications if I don't start taking the insulin or inject myself insulin? What will happen to me? Will I die?
So I can start by saying that if you're finding it hard to start using the insulin, we normally have support groups. First of all, your healthcare provider will do some counseling on you, on how to use the insulin, on the importance, on the complications that may come about from not using your insulin. So besides that, we normally have support groups, and in these support groups you'll find that there are other people who are suffering from the same
condition,
facing the same challenges.
Okay.
So with these support groups, you can come together, you share your challenges, you encourage each other, and it is from this that you're able to get the strength or the grace to go on. But now if you don't follow the doctor's instructions, there are some complications that may come about from uncontrolled hypertension, uncontrolled diabetes. And one of the major complications is something that you normally refer to as diabetic ketoacidosis. So another complication of uncontrolled diabetes is damage to the kidneys, and this is because high blood sugar levels normally damage the blood vessels that normally supply various organs like the kidneys. So you find that this will cause damage to the kidneys, and you also have damage to the ears. You can have blurred vision. Actually, that is also a sign and symptom of
eyes.
Yes, blurred vision, like someone is not able to see clearly. It also presents as a sign and symptom of uncontrolled diabetes. So another complication is you'll find that when you get a wound or a blister or a sore on the feet, it will take so long, or it will take so long before it heals
than normally.
Yes, because there's poor blood supply to the feet.
Okay.
Yeah, so those are some of the complications of uncontrolled diabetes.
Who is at risk of getting the diabetes type 1?
If you have a family history of diabetes, maybe your parent or a sibling has diabetes, you are at a more increased risk of also developing diabetes.
Okay.
Yes.
I think this topic is so broad, we cannot finish today. I think we need to have a part 2. Daktari, we are so humbled to have you in our channel. Kindly tell us what is your channel so that you can go and subscribe and show you some love, because you've really educated us.
Yes, thank you very much. So I'm also a content creator, like she said. So my YouTube channel is at Community Medicine 916. So kindly subscribe and share the love. Thank you very much.
In that channel you have so many healthy videos. If there's anything about diabetes, hypertension, and everything else you want to know from her, go show her some love, view her videos, and also you get some more knowledge on the diseases, most of the more chronic diseases, right? Yeah. Community health.
Yeah, Community Medicine 916.
916, Community Medicine 916.
Yes.
Thank you so much. I don't know how to say thank you, but we appreciate so much as moving on with Auntie Rose channel, and may God bless you.
Bless.